Usually what I try and touch on pretty quickly is exercise, because I think I meet a lot of patients who are told that they need to restrict themselves with regard to their level of exertional capacity, and you can imagine that would affect quality of life for a number of young people. Another thing that we really try and talk about a lot is family planning and pregnancy concepts and inheritance patterns.
Any woman with congenital heart disease should be evaluated by a congenital heart disease specialist prior to becoming pregnant in order to evaluate her risks and to come up with a plan for surveillance during the pregnancy, as well as know implications for the baby and for her.
There are a number of complex genetic constructs that apply in our situations, but globally, we do feel that most of our patients can have families and tolerate pregnancy. However, we do have very specific risk stratification criteria that we use as a community, as CHD providers. And we provide a lot of guidance through pregnancy because I know that's a very important goal for a number of our patients. We do recommend certain screenings during pregnancy because one of the major things that does come up is whether or not I'm going to pass along congenital heart disease to offspring. That turns out to be a smaller risk than I think a lot of patients may hear at different times or another, depending on the people that they've interacted with. We do frequently collaborate with geneticists in cases that we feel like we need to provide greater clarity on that situation, to ensure that we create a multidisciplinary plan that addresses a birth plan and all of the needs that the patient has during pregnancy.